Okay guys, so the last muscle that we're going to release is going to be our posterior deltoid. So that's the muscle on the back of our shoulder. Okay, so at this point we've done all the other muscles. We've done our lat dorsi, which was that big muscle on the back. So that muscle brings our humerus, our arm, it kind of causes it to rotate inward and contributes to that rounded shoulder position. Okay, it kind of takes our shoulders out of neutral alignment. And then what happens, because our internal rotators get really overactive, it means our external rotators, so the muscle that rotate our arms outward, rotates our shoulder outward, they get lengthened and they get underactive. So if we have that arms fall forward sign, that is essentially excessive internal rotation. So those muscles get short, those external rotators shut down, and we need them to work. Okay, that's going to help to keep our shoulder joint in optimal alignment, and it also helps to keep our arms up overhead as well, and also to stabilize that shoulder joint effectively. But what happens is when those external rotator muscles shut down, our posterior deltoid, which is also an external rotator, it's not the main external rotator, but because the main ones have shut down, that's our infraspinatus and teres minor, which I'll talk a little bit about later when it comes to the activation exercises. Basically, they're not doing their job very well, and posterior deltoid is trying to take over and do the work. But the problem in it doing so is it causes some faulty kinematics within the shoulder joint itself, which is a problem. So with this muscle, if it becomes shortened, it tends to shorten the back of the shoulder joint itself, the shoulder capsule, and it causes because the shoulder is a ball and socket joint, the humeral head, which is the ball part of that joint, causes it to kind of glide excessively forward. That can cause some possible impingement and pain in the front of the shoulder joint, and that can block and restrict optimal motion. Okay, so there's a few kind of few problems that kind of happen with this muscle if it starts to try and take over and do the job of the other muscles that have shut down. So we do want to address it. We do want it to calm down. It is in a lengthened position, but it's one of the few muscles that get lengthened, even though it's an external rotator and it does get lengthened. It's become overactive again because it's trying to do the work of the other muscles. So we still want to release it. We're not going to stretch it. We're just going to calm it down. Okay. So then the other muscles, when it comes to us activating those, they can do it without this kind of getting in the way. So what we're going to do, we're going to be laying on our side. We're going to be putting the ball just at the back of the shoulder. So if you kind of feel that scapula, you'll feel that big bony ridge. You kind of follow it to the end and then just kind of drop off beneath it. You can even bring your arm back slightly, just kind of as if you're trying to squeeze your shoulder back together. You'll feel some muscle kind of tense up behind you. That's going to be your posterior deltoid right in there. Okay, so, and that's where we want to be putting the ball. So again, we're going to lay just on our side. Okay, I'm going to bring this arm out in front. Okay, and I'm just going to be putting the ball right underneath the back of that shoulder, right there. Okay, again, normally I could rest my head on a foam roller. Okay, I could do that. But again, I just want to bring that arm up. If I bring that arm up there, it puts that posterior deltoid in a lengthened position. Again, I'm just going to find that tender spot. I've got it right there. Again, I'm just going to hold 30 seconds to 2 minutes, or until I get a release. Get a release in that muscle. And that is it. That's all we're going to be doing. Okay, and then that's the end of our release techniques. Okay, so that's our posterior deltoid we did right there. Okay, and then in the next videos we're going to be looking at doing our mobilization technique. So look out for that next video.